Hello, Thank You community. This is Dr. Fatima Sadat, Medical Science Liaison for Otsuka Pharmaceutical Development and Commercialization Incorporated, and I'm joined here today with Dr. Timothy Aungst, an Associate Professor of Pharmacy Practice at Massachusetts College of Pharmacy and Health Sciences University. He is also a clinical pharmacist and a digital health advocate in the pharmacy space. Today, we are here to discuss the COVID-19 pandemic as it relates to pharmacy practice and pharmacists. So let's dive right in. Dr. Aungst?
Thank you, Dr. Sadat, for the introduction. I think we are definitely at a point where how we view our current workflows in kind of clinical practice has been thrown up in the air. I myself generally work in home healthcare, and I'm definitely not doing home visits anymore at this current time. And how we are delivering services has definitely just been thrown up. I think some big questions is just what is going to be the new normal afterwards, especially related to pharmacy. And I would envision that post-COVID, what we're going to look at is an era where we're going to see a bigger push from patients demanding, let's say in a staffing position, more remote verification and patient education services. Not necessarily that this may be done at the point of drop-off of a prescription or dispensing medications. I think remote education and remote verification is going to take off. The remote verification can be handled differently through different systems, and that's been pioneered for years. I would say this just escalated how fast that could go. But patient education, I think, is something that I would envision right now is a very difficult thing, especially depending on what we're talking about for diseases. I would say, for oral therapy, talking about med and going over with a patient in terms of like through a phone or telemedicine visit, wouldn't be too hard. But if you were to imagine if I was to discuss to you how to set up a new injectable device or a new delivery like an inhaler and educate someone over that, that's going to take some learning from us. That's going to take some better development in how to do that, especially if we're going to see social distancing still go on for quite some time. So I think that is going to have to be something that has to be paid attention to and developed. Along with that is also just novel means to reach out to patients and check on adherence. I think it's going to have to go beyond just sending text messages or reminders. I think there's going to have to be some level where we have to have some kind of touch point, just go over with patients. Even if we see that they're not adherent, we're going to have to do a reach out, not wait for them to come into clinic and say, let's talk about what's going on. And I would imagine it's also due to different levels of social determinants of health that this could be a factor to consider why people may become more or less bad with adherence, especially with what things are going on right now. We're looking at like, financial difficulties, economics, and such like that. That could be other things that we have to factor in. And I think the challenges, especially for the pharmacists at this time, are going to be expanding. We see difficulties with PPE material, having masks and able to do that. That's going to impact our ability to compound medications. Big concern for me right now, not even just doing the interactions and running a business in terms of having in the pharmacy or talking with patients. And because of that, I think there's going to be different challenges associated between inpatient and outpatient pharmacy. I think there's going to be different dynamics of what barriers and what frustrations each are going to be faced with right now. The other thing is from the financial standpoint, we're probably going to see a reduction of hands-on services. Vaccinations was a big business for some pharmacies, compounding services and such. And I think the other difficulty, especially right now, I'm guilty of this, is we are concerned about flu season possibly in next fall and winter, but right now it's it's allergy season. So I've been having a cough, and my wife looks at me and she says, "What's going on?" I'm like, "No, it's just my allergies." But it's like, we're at that point though where we have patients have different symptoms and not sure, are they ill because of something that's just happening from allergies, or do they have an infection? So people go to the pharmacy, ask these questions all the time. That puts us in the front line for that and how to address it. So I think there's definitely going to be some worrisome nature about that, how to address it. And these are concerns I think that we're still navigating, trying to figure out, especially with this stuff not going away for quite some time. And it's, personally, and seeing in my region in Massachusetts, going with that then is we're seeing so many different laws being changed and new regulations. And I think this is very difficult for a lot of pharmacists to keep up. Is this like, how do we keep up with all the new federal changes? How how do I keep up with my state changes? What can I do and what can't I do with all this stuff? Big thing has been, for me at least in my state, has messaging from the state board has been valuable. And I think that's one thing is just keep up that channel, just see new updates, talk to other pharmacists, what's going on and what's coming down. We're seeing like the rationing of care. We're seeing basically how we traditionally handle things kind of disappear. And instead, we had to kind of do what we can to help serve the patients the best that we can at the end of the day with the limits that are imposed on us. And I think it can go one or two sides for pharmacists then, as they may try to be very conservative and very safe with decision-making processes, but that could put patients at risk versus understanding that there are kind of these let's say more soft guide points coming out saying do what's in the best interest and we'll kind of deal with the consequences afterwards. And I think that's something that is really difficult, especially for our profession, which we do like rules and regulations. And when we see all this stuff going out, we kind of puts us in this difficulty where we have to decide what is feasible and not. And I would say talking to other colleagues, that is definitely one of the things that seems to be going through a lot of people's mind is like, okay, so what can I do? What can I do? Do I have to contact someone on this? What do I need to document? What's in the patient's best interest at the end of the day seems to be the biggest question though that needs to be addressed. And I think looking towards, I would say at least your local state guidances are pretty much helpful at this current point. And if you don't know, send a question off to them, and because it's probably a question other people are thinking about. So these are a lot of things that are being going on, like the pharmacy world I've been hearing about, especially in this current pandemic. And these are just some of my general thoughts at this current time.
Thank you, Dr. Aungst, for your time, and thank you, Psyche community, for your continued support. Have a great day.